Decoding Inguinal Hernia, a comprehensive guide for medical professionals. Introduction. Greetings, fellow medical professionals. Today, we unravel the complexities of inguinal hernias in our pursuit of understanding and mastering this common yet intricate medical condition. Join me as we explore the anatomy, causes, clinical presentations, and management of inguinal hernias. An inguinal hernia occurs when abdominal contents protrude through a weakened area in the inguinal canal. It's a prevalent condition that demands our attention due to its potential complications. Slide 2. Anatomy of the inguinal canal. Before we dive into the details, let's revisit the anatomy of the inguinal canal. Understanding the structures involved will provide a solid foundation for comprehending the dynamics of inguinal hernias. Anatomy of the inguinal canal is of paramount importance for the surgical management of inguinal hernias. As a natural canal with orifices, widening can develop to let other structures from the abdominal cavity pass through to the extra-abdominal space. Chronic increase in abdominal pressure is known to be the main cause of this type of hernias. Inguinal hernias are a common surgical problem that often necessitates surgical repair. A clear understanding of the anatomy of the area is crucial to do a proper surgical repair of the inguinal hernias. The inguinal canal is made of a floor, anterior wall, posterior wall, and a roof. The floor of the canal that is made of the inguinal ligament. The inguinal ligament is a thickened inferior portion of the external oblique aponeurosis. The anterior wall is made of the external oblique aponeurosis. The posterior wall is made of the transversalis muscle. The more complex part, the roof, is made of the combined fibers of the internal oblique and transversus abdominis muscle and aponeurosis, including the conjoint tendon. The conjoint tendon constitutes the main part of the medial portion of the posterior wall. Types of inguinal hernias. There are two main types of inguinal hernias, indirect and direct. Indirect hernias pass through the inguinal ring and are more common in younger individuals, while direct hernias protrude through a weakened area in the posterior wall of the inguinal canal, often seen in older adults. Causes and risk factors. Various factors contribute to inguinal hernias, including congenital weaknesses, increased intra-abdominal pressure, and aging. Recognizing these factors is crucial for both prevention and early intervention. Clinical presentation. Identifying the signs and symptoms of inguinal hernias is paramount. Patients often report a bulge or swelling in the groin, which may be reducible or irreducible. Pain, especially during activities like lifting, coughing, or straining, is another common complaint. An inguinal hernia that can't be moved back into the abdomen is called an incarcerated hernia. This is a dangerous situation because the part of your intestine inside the hernia can become strangulated, which is a medical emergency. Symptoms of a strangulated inguinal hernia include severe pain and redness, pain that keeps getting worse, fever, rapid heart rate, nausea and vomiting. Diagnosis. Diagnostic tools such as physical examination and imaging studies play a vital role in confirming inguinal hernias. A hands-on approach, including the cough impulse test, aids in the clinical assessment. The cough impulse test is done with the fingers placed over the femoral region, the external inguinal ring, and the internal ring, have the patient cough. A palpable bulge or impulse located in any one of these areas may indicate a hernia. The examiner should then return to the sitting position. Slide 7. Management options. Management strategies range from watchful waiting for asymptomatic cases to surgical intervention for symptomatic hernias. Open and laparoscopic approaches offer effective solutions, each with its own set of considerations. Surgical options include herniotomy, herniorrhaphy, hernioplasty. Slide 8. Complications. While inguinal hernias are often benign, complications such as incarceration and strangulation demand urgent attention. Recognizing warning signs is crucial to prevent serious consequences. As medical professionals, a profound understanding of inguinal hernias is fundamental for timely diagnosis and effective management. Thank you for joining me on this exploration. If you found this video insightful, don't forget to like and subscribe for more medical content. Until next time, stay informed, stay vigilant, and prioritize the well-being of your patients. Goodbye.